The 1970s were a time of dramatic change in the global cancer community. From the signing of the National Cancer Act in 1971 to First Lady Betty Ford's public disclosure of her breast cancer diagnosis and mastectomy, from the development of new treatments in the fight against breast cancer to new methods of breast cancer detection and screening, the time was right for a new forum for oncologists to share the latest advances in patient care. Doctors William L. McGuire and Charles A. Coltman, Jr. developed a program designed to significantly reduce the death rate caused by breast cancer in San Antonio and surrounding counties. The first annual San Antonio Breast Cancer Symposium was held on November 11, 1978, at the La Mansión del Norte Hotel near the San Antonio Airport.
Initially, the goal was to educate local oncologists and surgeons and pathologists and radiation doctors locally. And I think we had 50 people attend the first meeting. But what was most striking about it is the speakers. And we had nationally and internationally known speakers for this little bitty meeting, including Ed Fisher, Bernie Fisher, who were leaders in pathology and surgery of breast cancer at the time. We had a guy named Nate Berlin, who was an expert in mammography about it and the endocrinology. So the speakers that we had were really first-rate, the top-of-the-line speakers, giving talks to community oncologists at this little motel in San Antonio. After a couple of years, we were starting to make real progress in breast cancer, understanding the biology, and new treatments came along, tamoxifen being one. And so Bill McGuire and Chuck Coltman, the directors at that time, came up with the idea of offering abstracts to be submitted by other doctors that would then be chosen and presented at the meeting.
Dr. McGuire, with some, I'm not sure help, but at least participation from me, started the journal called Breast Cancer Research and Treatment. The first volume of the journal included the program and abstracts from that year's San Antonio Symposium.
The San Antonio meeting became the major venue in the world for presenting new data on the basic science side and the laboratory science side and the clinical research side. And it just grew and blossomed over time and became the meeting in the world related to this issue.
The first time I went to it was in the late 80s when I was doing my training in oncology. It was a few hundred people. We all fit in one hotel. And I remember that I met some of the giants in the field at the time. These are people that became my long-distance mentors.
My first SABCS was in 2000. I remember back then we were talking about sentinel node biopsies and whether those were going to be the standard of care for breast cancer, and we all know now that they are. We were talking about drugs such as fulvestrant and comparing them to aromatase inhibitors, finding out that they're very potent drugs, and again, they're becoming standard of care. We were talking about bisphosphonates and whether they can help women with bone metastases, and we know that that's true. So when looking back in the past 17 years, what we learned from the symposium in 2000 has become standard of care, and we're using it today.
As the symposium grew in importance through the years, it became evident that San Antonio was the venue where the latest advances in breast cancer research and treatment were presented to an expanding global audience.
Many of the important discoveries, both clinical and basic, were presented initially at this meeting.
Every year, there are 2 or 3 key benchmarks that are presented. Every time there's a major finding in breast cancer, that's one of the very few meetings where people present it for the first time ever.
Studies about the estrogen receptor and its importance in breast cancer and predicting response to hormonal therapies. A lot of that early data was presented at this meeting. In 1978, very few laboratories were even measuring the estrogen receptor. And by the early 80s, almost all hospitals were measuring estrogen receptor because of its importance.
The first time we heard about dose-dense chemotherapy, for example, it was there. The first time we heard about adjuvant therapy for HER2-positive breast cancer and the major impact it had on the natural history of that disease, it was there.
You're looking at aromatase inhibitors. In 2001, the pivotal trial was presented with the use of aromatase inhibitors in the adjuvant setting. I was sitting in that room listening to that talk, and then remember a talk right after that looking at tamoxifen, where the speaker said, well, this is old news now, we have better drugs out there.
I remember one talk a few years ago, the results of the ATAC trial, comparing different forms of hormonal therapy as adjuvant therapy of breast cancer. And that was one of the first studies to look at aromatase inhibitors versus tamoxifen. And everybody was on pins and needles to hear the results of that. And that was presented for the very first time at this meeting.
We're looking at immunotherapeutic drugs now in breast cancer. We're looking at anti-HER2 therapy in breast cancer using antibodies such as trastuzumab that have helped millions of women fighting breast cancer. These are really big milestones. You're looking at surgery and how this has evolved from a total mastectomy to a lumpectomy and radiation to sentinel lymph node biopsies. Those are all milestones that are connected to the symposium and the past 40 years of our therapy.
The voices of patients and survivors have been an integral part of the San Antonio Breast Cancer Symposium from the very beginning. The first symposium was part of a citywide effort to increase awareness, and it included several breast cancer self-examination programs, as well as a public lecture from noted breast cancer survivor, author, and advocate Rose Kushner.
The patient advocate program at the San Antonio Breast Cancer Symposium began 20 years ago. Doctors Coltman and Osborne came to Alamo Breast Cancer Foundation, to our founder, Dale Eastman, saying that more and more patient advocates are attending. We want them to have their own little sessions so that they can understand more what's going on.
Involving the advocates became something that was routine for our meeting. And now there's actually separate sessions devoted to the advocates, and a fairly significant number of advocates and patients come to the meeting to learn what the latest is in breast cancer.
We worked with the National Breast Cancer Coalition to develop Project Lead Advanced Topics. And then a year later, we started working with Karen Mills at AACR to develop a more basic science program for the patient advocate.
The advocates play a huge role in our symposium. They're part of our program committee where we discuss what talks we're going to have for the next year's symposium. They're part of our abstract selection committee when we talk about the most important abstracts that are going to be highlighted.
This year we're also working a lunch session with AACR and the FDA on how advocates can work on different committees and help the FDA.
It reminds us of what are the unmet needs, what should be the priorities.
Collaborations are key to the ongoing growth of the symposium, all with patient benefit as the ultimate measure of success. From the 8,000 participants from over 90 countries to the stellar and steadfast leadership provided by the organizing partners, UT Health San Antonio, the American Association for Cancer Research, and Baylor College of Medicine, the symposium is the vital touchstone for all sectors of the breast cancer community.
The SABCS clearly has a huge impact in the field of breast cancer and has been a key cornerstone of this cancer center. There's tremendous pride here in the city, at our center, as well as with our close partners at AACR and at Baylor for hosting this event and really having it be a great resource for the field of breast cancer.
It has really been an honor to be a co-director for SABCS. Working with Dr. Osborne and Dr. Arteaga has really been a dream come true for me. Being in a room with them and exchanging ideas and talking about the novel therapies and which abstracts should be presented and how to plan next year's symposium.
It's been a very natural and seamless, synergistic relationship.
And I think it's been a good partnership. We spread the work around. Somebody does this, somebody does that. It has added to the scientific content of the meeting and the educational value of the meeting.
This is really an amazing experience, and I'm extremely lucky to be there.
One night at a meeting with Marge Foti, the CEO of the AACR, we started talking, and I said, do you think the AACR would be interested in co-sponsoring the meeting with us and adding some more basic science to our meeting that at that time was becoming more and more clinical?
And we both felt that the AACR could expand that basic science, that translational science that was already part of the meeting. We have awards that focus on individuals that were not really part of the meeting, more on the laboratory side, if you will. We have contributed to educational sessions that were not part of the meeting before. This year we're going to have workshops that were, again, another idea that came from the AACR, workshops from physician scientists and from clinical investigators. I feel strongly we have made a big contribution to the meeting.
The Komen Foundation may be the major organization of that type that has sponsored the meeting, and we've had a good partnership with the Komen Foundation. Over the years, they present their awards for scientific distinction, called Brinker Awards there, one for basic science, one for clinical science. I think it's been a great mutually benefiting relationship with the Komen Foundation over the years.
We are in an era of extraordinary progress against cancer. More patients than ever before are surviving a diagnosis of breast cancer. Because of its enduring innovation, the San Antonio Breast Cancer Symposium can take pride in the realization that it has played a major role in these advances. What does the future hold for breast cancer research and care?
Our research is evolving. It's different than what it was 40 years ago. We want to make sure that we have biologists, we have physicists, we have physicians participating, exchanging ideas.
Our ability to personalize care is probably the most important. Scientists develop the ability to interrogate a breast tumor and other cancers as well, down to the very genes that are broken to cause the cancer in the first place. The ability now to give less therapy for some patients and more therapy for other patients, depending on what kind of cancer they have, is where the action is right now.
I also see that we will incorporate the IT biotech with the traditional basic and clinical science of breast cancer to look at what we call big data. Now, we no longer can study a single gene. We have to study pathways, big databases. And that will also allow us to create ways of following patients, because we have a good problem, is that we're going to have an increasing number of breast cancer survivors. So I think all of that are aspects that the meeting will have to incorporate.
Well, to be honest with you, I wish the symposium would end, because that would tell us that we've conquered breast cancer.
The San Antonio Breast Cancer Symposium will continue to shine brightly as the premier meeting in the world for the presentation of cutting-edge research with the urgent goal of conquering breast cancer once and for all.